I'm Peter Haigh. I'm one of the general cardiologists here at UK Healthcare, and I am one of the valve specialists. I sit on our valve committee, and I'm also part of the structural heart team as an imaging specialist. To talk about valvular heart disease, I think it's helpful to review what the valves in our heart do when our heart is beating normally. All right, you can think of the valves as little doorways in our heart that open and close to allow the flow of blood through our heart in an efficient manner. So valve disease boils down to two problems. Either the valve doesn't open properly, we call that stenosis, or the valve doesn't close completely, causing blood to leak back the wrong way, which is regurgitation. We have lots of different management strategies for valvular heart disease. Depending on what valve is involved and what is going on, we have multiple treatment options, both in the operating room and minimally invasive approaches in the cardiac cath lab. As part of our comprehensive valve clinic, we have multiple different roles and specialties involved, from the physicians like myself in cardiology, imagers, surgeons, and interventional cardiologists. We also are supported by a tremendous staff in terms of nurse care coordinators, cardiac pharmacists, and even cardiac psychiatrists help those patients that are struggling with the emotional and mental health components of heart disease. So here at UK Healthcare, we've been caring for patients with valvular heart disease for a long time, but the establishment of the comprehensive valve clinic will allow us to make sure that patients don't fall through the cracks. So this means that they see their doctor at the right time point in their care. They get the right surveillance imaging before and after they have a valve procedure. A few decades ago, patients who had valve disease, it meant they were going to the operating room for surgery. But now we have multiple treatment options, and in many cases, we can treat the patient in the cardiac cath lab through a catheter without the need for surgery and a much easier recovery time.